Okay, my name is John DeLiva, third year Western U student, currently rotating with Dr. Ben-Zur at the Cardiovascular Institute in Tarzana, California. Just wanted to go ahead and talk to you today about EKGs, 18-year-old asymptomatic male. So an 18-year-old asymptomatic male being screened for participation in a high school basketball. One of the first things that you want to look at this EKG is first determine the rate. So I would go here. Look at lead 3. Okay, so 300, 150, 100, 75. Okay, 300, 150, 175. So it looks like that the ventricular rate is approximately 75 to 100. Now you're just going to go ahead and look at the rhythm. Make sure it's sinus. So first thing you have to do is look for the QRS complex. Is there a P for every QRS? Yeah, there's a P for every QRS. There's a P for every QRS. Here in lead 2, P for every QRS. P for every QRS in lead 1, V1, V2. Okay, so is there a QRS for every P? So you look at the P, there's definitely a QRS. A P, there's definitely a QRS. And again here, same in V6, V5, and V4. Okay. So once you get that down, now you know it's normal sinus rhythm. You look to see if there's any PR, any shortened PR or prolonged PR intervals. Now I don't appreciate any elongated PR or shortened PR intervals. Everything remains the same. So now you just go ahead and you look and you scan, looking for any abnormalities. This one's a pretty hard case, I must admit, but it's very interesting. So one of the things that I found that you can see in this EKG is that if you look at leads 1 and AVL, these two blue arrows, and one of the things that you see here is that the PQRS and T complexes are all negative. See that? P, QR, S, T. P, QR, S, T. And you can appreciate that leads 1 and AVL have this negative complex. And this is only seen in dextrocardia or if you reverse the limb leads. So you're looking at this and you're like, okay, which one is it? Is it limb lead reversal or is it dextrocardia? So let's go ahead in here. So dextrocardia is associated, and limb lead reversal is associated with inverted P, QRS, and T waves in leads 1 and AVL. The next question I can ask is, so what confirms the diagnosis of dextrocardia? So we go back here, and we look at the red arrows from V1, these are the precordial leads, V2, V3, V4, V5, and V6. And one of the things that you notice is that if you take a look at the R wave and its amplitude, you notice that as it goes from V1 to V6, the R waves start to diminish. And this is what, so it confirms the diagnosis of dextrocardia. That's what confirms the diagnosis of dextrocardia. It's the diminishing R wave amplitude across the precordium. Okay. Other things to note here is that's it. That's pretty much it. I don't see anything else to note except for the fact that, again, to recap, we have negative P, QRS, and T in leads 1 and AVL. So that tells you either way it's a limb lead reversal or it's dextrocardia. So what confirms the diagnosis of dextrocardia? You look at the precordial leads from V1 to 6. If the R wave amplitudes begin to decrease from V1 to V6, then that confirms your diagnosis of dextrocardia. Thank you.